I do have some concerns around just the overall immediate transition from the institutional settings to the community-based settings. I just simply don't think in the time frame that we're projecting we will have the resources. I'm not convinced that there's a clear-cut, tangible plan, and maybe after this we can take a look at it. But you know, we have to realize that everything is not about costs, immediate costs or savings, because when you close the door in one area, you're just opening up other burdens in other areas. For example, we transition these patients out of the institutional area, and we might be creating homelessness, higher crime rate, higher substance abuse, and our monies will be reinvested in prison facilities. So my question is around the substance abuse. I noticed that there's a increase, $5 million increase for opiate abuse prevention and treatment programs. So my question is, are you expecting to have more patients to be opiate abuse, and is it a result of the transitioning? Because
Okay, the $5 million for addressing that is really Commissioner Arlene Sanchez from OASAS.
Okay, I'm sorry.
So in terms of the opiate use.
Okay. Well, so can you, and I know you touched it a little bit, but can you give me a clear sense of some of the programs, in particular in Brooklyn? I represent Brooklyn. That you'll be readily available for those beds or those transitions that are being taken place. We're hearing that there's a lot of beds that are transitioning from Brooklyn to Staten Island. And so we want to know what are the reinvestment plan for the area of Brooklyn, New York City in particular.
Yeah, we're working very closely with the Department of Health and Mental Health on the plan of the city, on the plan for New York City. And some of the things that will be in Brooklyn are additional supported housing beds, which are apartments, with intensive wraparound services. So individuals discharged from either Article 28 hospitals or from RPCs, there will be a team that will work with them in terms of their adapting to being in the community and work with them, visit them in the home, et cetera, to make sure that the housing, that their experience in housing works. You know, when we've been doing this across the state, we've had a very low return rate at state hospitals because we've been very careful about bridging the individuals who are leaving the state hospitals to community-based housing. The other thing that will be in Brooklyn, we will now be supporting out of these dollars parachute services, which is an interesting respite and mobile crisis team combined service for individuals with serious mental illness who, when they are having a crisis, instead of going to a hospital, can go to these respite beds, and there's a mobile crisis team that is associated with that respite bed, as well as the mobile crisis team does work in the community as well. There will also be additional home-based crisis services for children in Brooklyn. So there are a number of crisis, a mobile team, and housing initiatives, which will be coming up in Brooklyn. And in our thinking, those were the things that were probably most helpful in keeping individuals out of the hospital. So those are the services we will be putting up.
What kind of model are you using for the housing? Because you know, if you're looking at a transitional model, a housing model, will it be regulated? Because currently some of our transitional housing is not well kept. Rodent infested, not clean, not sanitary, and we want to make sure that our patients have a clean, safe, healthy environment to go to, and that's regulated.
Any licensed regulated housing by OMH, if you see any that isn't clean and well-kept, and I would really want to know, because we do a lot of reviews. We go out and we do site visits, et cetera, to make sure that those services are in place and that they are appropriate. For the supported housing apartments, we make site visits to those apartments to make sure that the housing providers that have gotten those apartments, we're funding them. So we have the right to go, if the client gives us permission, into that apartment and see, is this what really is a good living situation? So we are monitoring both. So if there's any place that you see or you've heard of, I would really, truthfully, I would like to know, because we're very, very careful about making sure that when our clients go into housing, that it's the right kind of housing.